Welcome to the Neuro Wellness Podcast. I'm your host, Dr. Joseph Hippocampus, and today I am joined by my guest, Dr. Janine Cooper, all the way from Australia. Thank you for joining me today.
Hello. Our pleasure. Thank you for the invite.
So, Dr. Janine, you have a pretty extensive background in the world of memory, correct?
Yes, thank you. Yes, I began my career quite a number of years ago. I won't say how many because it shows my age, but I started because my great-grandmother had memory problems. And I can tell you a little bit how I got started if you'd like.
Yeah, I'd love to hear it.
So my great-grandmother had what we thought was the early stages of potentially dementia. And it got me interested in that area, but it also made me realize just in normal aging that you do see a decrement to, certain parts of memory. So I started by looking at normal memory, if you want to call it that, typical memory, and how it changes with age. I did that in my undergraduate studies, and then I took a year out and considered it and thought, yes, I definitely want to go back. And I did a PhD in neuropsychology in the University of Aberdeen and focused on confabulations and delusions in autobiographical memory and typical aging. And that's where my career started, really, using neuroimaging and just working with fantastic people who support memory, right from the neurologists and the neuropsychiatrists, psychologists, right through to allied health workers such as occupational therapists. And I kind of got to the point where I realized that memory is just such a fundamental part of who we are that it would be really interesting to not just look at the older age group and those who have got memory issues due to dementia, but then to look at the younger sort of side of the population. And that's what got me into the work with Farineh Varga-Tadem and Mortimer Mishkin, looking at the very fascinating but rare topic of developmental amnesia.
Mm-hmm. And we're going to cover a pretty wide variety of memory and memory problems today, so I'm very excited to dig in. But I thought it was interesting you got into this field because of your grandmother, and that's actually one of the reasons I got into my particular field, is because my grandmother developed Alzheimer's, and it's such a heartbreaking condition to see someone you love go through that. And yeah, I wanted to hopefully make a change for other people who are going through that eventually. So yeah, that's great.
That's exactly it, Joe. You realize when you see it firsthand, and it's something that just affects so many people that, yeah, it's just really interesting. We both did it for the same reason.
Yeah, absolutely. Dr. Cooper, typically our patients are very interested in concussions. Most of our listeners have sustained some form of TBI. That's the majority of our practice. One of the first topics we wanted to talk about today was the impact that a TBI could have on memory. Can you talk a little bit about that?
Yes, certainly. I've worked with adolescents with TBIs at the hospital here in Melbourne called the Royal Children's Hospital, and a wonderful research institute called the Murdoch Children's Research Institute. And so a lot of what I'll be talking about now taps into work that was done there in the neuropsychology department, and also from research that I've done with students looking at concussion and the effects that has on not just memory tests, so to speak, but also on how people live their daily lives, so activities of daily living. The biggest thing I think is that sometimes concussion has been termed, oh, it's just a bump to the head in past years. And I think now what's really great is that the awareness that we are now focusing on, that concussion is a serious issue, and we need to be really careful about how many concussions, for example, sports players sustain. So I'm happy to sort of answer any questions you have on that, but really it comes from I've always looked at memory as a fundamental part of who we are, and we use our memory from our past experiences to guide our future experiences. And when there's an issue with that, it doesn't just affect our ability to form new memories or recall past memories, but it actually affects the core of who we are, the self. And I think when your self-worth, your self-esteem is affected, I think that can have dramatic effects on your mental well-being. So, people do potentially have what they think is a minor head injury. There's nothing on CT, there's nothing on MRI, but they're having a massive problem with their activities of daily living, or they just don't feel like themselves anymore. And so really, I've looked at memory as this is a really problematic area that we need to focus a lot more time on, I think, is looking at. It doesn't have to show up on imaging, so to speak. We have to test how people are affected in terms of their quality of life or well-being, I think is a term that most people use now.
And imaging is usually black and white, so to speak. People can usually see whether there is or isn't a problem. Memory is a little different. You have to dig maybe a little deeper, get a little more creative. What are some ways that you can properly test for memory deficits post-concussion?
Great question, Joe. I think the interesting thing is that if you see somebody, for example, who's just sustained a concussion, they've had the injury perhaps on the field, or they've come off a bike, or they've fallen, is to just ask them questions and see if they start to repeat themselves, obviously, in the very first instance. But when I get to see clients, it's usually at the point where there has been an obvious issue arise in their memory. And that's usually from loved ones that say, my partner has now become really repetitive, or the person finds that they just can't recall things they were doing earlier in the day. But I think one of the things I've noticed is that a lot of what we call neuropsychological assessments, they're very good, obviously, at what they do. They can really tap into different areas of memory that are affected by concussion, for example. But what often happens with some of the people that I've seen with concussion is that they're actually performing still quite well after the concussion. So I like to use tests which really tap into everyday memory skills, not the neuropsych memory lists, so word lists which you have to repeat several times and then you have a delay. What I'm talking about is I set people questions at the beginning of the sort of session, or I ask them about things that have happened in the media, or if they follow a sports team, how their team are doing. And then at the end of the session, I then revisit those sort of questions and topics, and I see whether there is any signs of recollection. One of the tests I used a lot and still like a lot is the Rhythme behavioral memory test by Barbara Wilson. And I think the reason for that is it taps into so many different areas of everyday memory that a lot of perhaps more structured tasks that are a little bit longer to use don't always give you that sort of overview in such a short period of time, because it only takes about 25 minutes. But I do think talking and having a conversation is another great way of tapping into what I believe is a fundamental part of memory, which is autobiographical memory.
Yeah, and you've touched on a few, but there's so many different subtypes of memory, from visual spatial to working to long term to short term. So yeah, just going through lists isn't necessarily all encompassing. And we like to say on this show, every concussion, every brain injury is different. So every brain is impacted differently by each concussion. So you really need to look specifically at which area of memory may have been most affected, so that you can identify and work on that.
Absolutely. I think if your protocol has a variety of assessments that really can tap into all the different domains of memory that you've just covered, I think you get a far greater picture, a much richer sort of idea of what is going on in a person's life, because of course we're using different types of memory all the time, and they interlink so strongly with other areas of cognition such as attention and language and your ability just to, some people are very visual in the memory, some people have very strong auditory memories. And I just think that we need to be really good at being able to do exactly what you said, which is to look at everyone differently and see them as individuals. But I think one of the things that I found most fascinating just recently is working with players in the Australian Football League, which is the equivalent of Gridiron in, it's basically, it's not the equivalent, I should say. There's players of Australian Gridiron here in Australia, but there's also AFL. And it's been fascinating to look at the sort of work of people that are doing fantastic studies at the effects of repeated concussions in some of those high impact sports. And I think more and more people are becoming aware now that, you know, if you have a concussion, it can be extremely dangerous to then go back on the field too early because your brain is still bruised, even though you can't see that necessarily. So, yeah, I think different questions, different ways of looking at memory, and especially depending on how you sustain a concussion is very important.
And that brings me to my next question, actually, and how you sustain the concussion. Have you found that maybe a patient or a person who sustained a concussion is more likely to develop memory problems if they lost consciousness as a result of their head injury?
A good question. I think that's actually one of the sort of main ways is we look at the amount of time in of post-traumatic amnesia. We look at obviously the amount of time if somebody lost consciousness. I think certainly when I was studying, it was all about the length of time that you were unconscious. But I think even now, I think we've got to consider it. It's not just about the duration. It's about the how the concussion occurred. So, for example, there is some literature now that says, you know, linear concussion, where the head is moving forward, that the famous Contra-coup kind of injury, might not have the same effect as if the head is rotating and then it's hit within the temporal area, for example. That's work that's coming out of Australian Football League studies using the new mouth guard technologies, and something that I think is fascinating, that they're really looking at the type of impacts as well. So I think we can look at duration of being unconscious, but I think if you do lose consciousness, it is a major factor that should be obviously a predictor of potential greater injury, but it's not the only factor I think we need to consider.
That's really interesting. So have they found or correlated a linear versus a more of a rotational injuries? Can they pinpoint that, or have you found that there's any correlation between the type of memory that's affected in those injuries, or has that not been established?
Not the type of memory yet, but last year I interviewed, can I tell you the company? Because it was just this new technology, which is a mouth guard technology. It's called HitIQ, and I feature them in one of my podcasts, which is all about concussion in sports. And what it was is they were finding through a lot of research that they've been doing with major medical researchers in Melbourne, that there is this difference between the sort of the direction or the force of the injury. So as I say, linear versus rotational injury. And there does seem to be a difference in whether or not there will be a greater degree of issues with potential cognition, mainly memory.
Interesting.
That's the early information that I don't know if it's been published yet, but it at the time was just very experimental, but I found it fascinating and something I'm sure now has potentially been written up and hopefully is been published.
Yeah, very interesting. Not to get off course a little bit, but the next topic we wanted to talk about, and I think this is something very relevant to everybody in the world that's dealing with COVID, which is everybody, is stress, right? Stress seems to be at an all-time high right now. The next aspect of memory we wanted to discuss was how stress affects memory. What's the interplay between those two?
I think the best way to start is to talk about working memory, which is the idea that you have this type of memory, obviously, that's sort of, I call it my online, keep everything in your mind. You're taking pieces of information from your past, you're mixing it with the current, and it helps you to store information in a very efficient way and deal with current problems or decisions. What happens with, I like to think of working memory in a basket. So if you imagine it being carried along, you have a certain amount of capacity within that basket or bag to carry all that information. The thing with stress is that stress requires attention. It creates another thing that has to take precedence in that basket. So the storage of your basket is dramatically reduced when you become stressed and anxious. And the other thing is that your fear response then is activated, or your threat response. I think the problem for us with the pandemic is that we do not know how things are going to be in a week's time, 2 weeks, let alone a year. And that means threat is constantly in our everyday environment in a way that it has never been before. So our brains are coping with this new threat, and as a result, our arousal levels are going high. Those people, even that are very good at coping with stressful jobs, it's a different kind of stress. So it's taking away for that working memory capacity. So if we think of it like that, then working memory, which we need to remember what we're doing later in the day, well, that's perspective memory, but working memory is just keeping a track of that, and also sort of thinking about what you're currently doing. Something has to give. And that means that we start to become forgetful. And I think for people who are already stressed, that adds another level of complexity to it. So it's a bit of a vicious cycle, really, of the more stressed you get, potentially due to the pandemic and other things that you're having to do to cope with the pandemic, that will be affecting your memory systems. And I think we're seeing a lot of people having issues now with what we call everyday memory skills.
Yeah. And I'm sure you could expect test scores and work productivity to be a little more impacted right now because of that.
Definitely.
One of the great ways to manage stress, though, is by exercising, right? And exercise has been known to have some positive effects on memory. How is that possible?
So a great question. I think exercise we've found in the last 5-10 years that more and more literature has shown, more and more research has shown that exercise is just fantastic, full stop, for not just our physical, but also our mental health. And memory is something that if we can reduce the stress that I was talking about earlier, which you can do with exercise. So I like to think of it is that breathing is one of the first things you can do, but some people go, I don't want to be doing sitting down and doing 4 deep breaths in and 4 deep breaths out. So that's fine. If you can do breath work though, what it does is it slows everything down. It takes away from that sympathetic nervous system kicking in and the threat response and your heart rate going up. You get sweaty hands, you get a dry mouth, you start to panic a little bit. And what exercise allows to happen is that the fundamental part of your brain that looks after you, your parasympathetic nervous system, kicks in, and your vagus nerve, which is one of your 12 cranial nerves, gets sort of activated, and it slows your heart rate down. It allows your breathing to become more regular, and therefore you can take more oxygen in. And as you take more oxygen in, more oxygen gets into your bloodstream, which then goes to your brain, which then calms your brain, which then makes your brain work more efficiently. So if we look at it like that kind of mechanism, breath is a really big part of exercise, and exercise is a really big part of slowing everything down. And that allows the basket to reduce some of that stress and more memory space, and therefore your memory improves. And I think hopefully that's the best way I can describe of just how effective exercise is. And the more you do it, the more your breathing gets regular, the more your body benefits, your heart, your lungs, everything starts to feel better, and you become more productive. And I think that's in some ways, I think exercise has been many people's savior in the COVID pandemic, because it's allowed them to just keep a little bit of calm in their day. And those that can't exercise, try a little bit of breath work. It might sound like something that's too simple to work, but I found it's been absolutely brilliant for many people who are very, very stressed, and they find their work productivity goes much, much higher when they start to encourage that side of their lifestyle, bringing breath work in.
So would you suggest that maybe an aerobic type of exercise may be superior to an anaerobic type of exercise when it comes specifically to improving memory and decreasing stress?
That's a great question, because actually a lot of people have asked that. Is it better that I do, for example, jogging where my heart rate gets over 120 beats per minute? The answer to that is the literature is a bit varied on it, but actually doing any form of exercise where you're focusing on your breath is actually very beneficial. So any exercise is better than no exercise. If you look at types of exercise, if you look at aerobic, then it has been found to be very beneficial. But small amounts over the course of a week are much, much better than one large workout session at the weekend, for example. So even just walking for 15 minutes to go and get groceries and then coming back, and just walking that little bit faster is much, much better than trying to do a really fast jog and you're not prepared for it. But the other type of exercise that's been very beneficial is actually weight training, as well as things like yoga and Pilates, because you're focusing on the breath and you're also calming your whole sympathetic nervous system down again. So I think if it was me, I would be very happy to do a fast walk, maybe 3 times a week for 20 minutes. But actually, I find things like yoga and Pilates are very, very beneficial, because they do focus attention, take away from stress, and they also strengthen your muscles in a way that, again, you're consuming oxygen with the breath work, so everything's benefiting, including the brain and memory.
I thought there was one interesting study about, this was about aerobic exercise in particular, but it actually found that aerobic exercise was correlated with increase in hippocampal volume size. So that's obviously very important for memory. Maybe you can explain why that is, because I think that will perfectly transition us into our next topic.
Beautifully done. Yeah, that's a very good transition. So, for example, there is a really good study that looks at aerobic exercise. Again, even in yoga, people that are very good at yoga, they're doing very deep breath work, so their lungs are really at full capacity. It's the same with, obviously, aerobic exercise in general. And what happens is the amount of oxygen that comes into your bloodstream will go to certain areas of the brain that use a lot of energy. And one of those areas is the hippocampus. So these two, one on each side of the brain, the left and the right, 2 little areas which are the size of about, or the shape of an almond if you're looking at it from the front to back. And they take in a lot of that energy, and something called long-term potentiation takes place there. And as a result, they're hungry for energy. And so as a result of doing aerobic exercise, the heart rate, as I say, is your heart, your lungs, everything is working at a much better capacity. And so more oxygen gets to the brain. And as a result of that, a lot more energy gets to those areas that use it effectively, which is partly why the hippocampus has been shown to change. One thing I'd like to point out is that some people believe that the volume is to do with new neurons being created. I'd like to think it's potentially not that. It's more likely that connectivity within that region of the brain increases. So we're looking at white matter increases around the area of the hippocampus. I think there's a lot more work to be done about why the volume or the size of the hippocampus changes. But we know that with when you use that part of the brain a lot, there are changes in its function in terms of, like, for example, Ellen McGuire in the taxi driver study, you see changes in the actual structure of the hippocampus, not just its size. So aerobic exercise, definitely keep doing it. And if you're not doing it, maybe just start slowly to try and increase the amount of oxygen that gets into your body, because it will help your lungs, your heart, your whole of your physiology, but also your brain and potentially your memory. Yeah.
Perfect. And your work in particular is on developmental amnesia, which looks very closely at the size of the hippocampus and how that may maybe atrophy or may not develop appropriately in adolescence. For those who aren't familiar, because this is sort of a harder diagnosis to come across, can you describe this condition a little bit?
Certainly. So developmental amnesia is a syndrome which was first published by some leading researchers, two of them being Professor Farineh Barghoor-Khedem, who I used to work for, and Professor Mortimer Mishkin. Also David Gadian, who's a fantastic, works in neuroimaging. And what they discovered is that children who are very young, so infants, who had a hypoxic or ischemic injury, so they'd gone without oxygen. Potentially it could be that their lungs hadn't developed properly and they were not getting enough oxygen. They would later in their childhood start to show specific problems with episodic memory, so event memory. However, factual memory or knowledge about the world for semantic memory remained relatively spared, as did most other types of memory and other cognitive abilities. And so over the course of many years, they started to look at groups of children who might be potentially more at risk of developing or having developmental amnesia. For example, prematurity could create a hypoxic or ischemic issue. Also, cardiovascular issues in a neonate, and also children that had to go on to life support, which was my particular area of research. So, extracorporeal membrane oxygenation, ECMO. And what we found is that children who have had a longer period of hypoxia are more likely to potentially show signs of developmental amnesia. And what that means is that there is actually a structural change to the brain in the region that we were talking about earlier, Joe, the hippocampus. And what we found from the earlier studies is that it doesn't have to just happen at birth, obviously. This could happen in childhood, but it looks quite different. The behavioral or cognitive profile looks quite different than it does in an adult that has had an injury later in life. And one of the reasons for that is that potentially the plasticity of the brain, the ability for it to form new neurons, changes as we get older, and we've got greater plasticity, as obviously you'll well know when we're very young. What has to happen, therefore, to have developmental amnesia is that there's a fundamental issue with the hippocampi structurally. Usually, you have to see a bilateral, so a reduction on both sides of the brain, of about 25%. And that was research that came out of Farineh's research group, which I was very fortunate to be part of in 2009, we published in 2011. But what you see behaviorally or cognitively is that children don't have problems really in any other area of cognition other than episodic memory. And we're talking extreme issues. So they could come into the assessment room, I could introduce myself, we could chat for 15, 20 minutes. I would then revisit a topic like I talked about at the beginning of this interview, and they wouldn't remember that. Or they would go to the toilet to use the washroom, and they would get lost on the way back. So we're looking at some fundamental issues which are really to do with sort of spatial or hippocampal based memory, and episodic being the predominant feature, event memory.
Mm-hmm.
Very rare though, fortunately.
Yeah, what is the percentage of the population that might develop this?
I couldn't give you the exact figure on that, but I think we're looking at, I mean, we're talking case-wise, we're talking out of, I think it was 80 children that I saw that had ECMO or conventional management. We're looking at 3 or 4 that had potential issues of the developmental amnesic type, and they were children that had been obviously invited to take part in the research because they had extreme hypoxia.
Mm-hmm.
So it has to be something, I think it's a very small amount, but I can't give you exact figures because the research is moved on since I last worked on it.
Right. And obviously this could potentially be a very troubling condition for a young child or an adolescent to have and to experience. What are some of the challenges that they may face, say in school or at home, that are dealing with developmental amnesia?
I think one of the things is to remember is that if it happens very early in life, so in the first, as an infant around the neonatal period, or in the first years of life where children don't know any difference, it's more the parents that will see the effects of why their child is getting told by the teacher potentially that your child's a little bit, isn't having. I'll use the terms that I've been told: lazy, naughty, they don't listen properly. These are not things that I would ever like to label a child, but this is what has been said to parents. As the child gets older, if they then have a hypoxic or ischemic injury by the age, let's say, of 6 or 7, then you will see some fundamental changes in their well-being as well. So it has quite an impact, just like a concussion would, in that, any brain injury, when a child's been aware of a previous ability level or a previous way of life, and then can no longer do the things they used to, that can really affect their mood. So a lot of the children did show a little bit of anxiety and depression. And that could be something that could range from just feeling like they don't fit into friendship groups because they can't keep track of conversations or forget very quickly. Or it could be that they're just labeled as different. And I think that's the biggest thing that I found fascinating and also was very beneficial to research that we did at the Institute of Child Health at UCL, is that we were able to give parents and children a label or a diagnostic kind of label to say you could have developmental amnesia, and they would then take that back and tell the teachers, tell the education authority, and they would then get support for that. And I think that created such a difference in their world, not just the child, but the parents and the whole family and the school system as well, because they then had, they could help, they could discover why the child was not necessarily being able to do the work. I found that probably the most rewarding part of the job is being able to take research and apply it back to the people that really will benefit from it. It goes back to what we said at the beginning of the interview, Joe, about we got involved in this for the real people in our lives. And I think that's why once I left London, I came to Melbourne, I've focused very heavily on rehabilitation techniques to be able to use innovation to support children with memory problems. So developmental amnesia, although it's rare, it allows you insight into what can happen to children, and also how it differs from adults, and how we need to be a lot more aware of how to support children, because a lot of people aren't aware that it even exists, or that memory problems exist in children. I think they just presume it happens as we get older, but we really do have these problems. I'm sure you've seen.
Yeah, and we've seen cases in this office, and it's very, very difficult. If there was maybe an educator who was listening to this, or a parent who was listening to this, and they knew they had a child who had developmental amnesia, what are some strategies that might be helpful for the educator or for that parent to help their child succeed or to strive to be their best?
Oh, thank you for asking that question, because that's great to be able to share this. So some of the strategies can be, some people think it's very simple to be able to take a diary or notes, but I would say it's not everybody's cup of tea. So that's the first thing I would do, is just to jot down on a notepad, or if the person has an electronic device, put that into a little diary, so that when you get to the end of the day, you then look back on the day and you read over it several times, and it will create, and we're talking obviously probably a more serious episodic memory issue here, but it helps people to not only remember what they were doing, but who they are. It also allows them to make friendships because they can trust that it happened. And a lot of paranoia comes from having memory issues, especially in children. And then the other things would be to exercise, keep fit, because again, we've got that oxygen. And we know that memory in children can actually, it can change quite dramatically as they get especially with hormones, as they go through puberty. So keeping fit and healthy, lots of oxygen. And I think also just the other thing is to have people in their lives aware of this is not something that makes a person different in a negative way. Let's keep an idea that this is just something that has to be worked with, and to try and encourage the child to be involved in everything that they've got an interest in. And just by keeping notes and having a calendar and reminders and notifications, that can actually act in a way like the hippocampus. It can sort of, you almost want to recreate the role of the hippocampus. And that is to take in information such as your diaries and your notes and your sort of ability to create a little story, and then also to notifications to recall things that you might be having to do in the future. I know that's a very basic, what sounds quite basic, but it's fundamental to the beginning of changing things in a child's life who's got a memory issue.
Yeah. Yeah, and it's the simple things, if you're able to enact them in a consistent manner, that tend to, have the greatest effect, I think.
I think so too.
Outside of maybe developmental amnesia necessarily, if you were to give just general advice to anyone listening who may have identified in themselves that they're starting to struggle with memory, or they may be slipping in certain areas, exercise was a great example of something they could do. But what are some other general things that people could do to really make sure that their memory is top notch?
Again, it might sound repetitive, but I think having a really good calendar system so that everything goes into a calendar, so that you don't have to rely on your own memory system to be able to tell you what's happened or what is going to happen. The reason I say that, Joe, is because the stress that you then start to feel will then impact further on your memory. Also, having people in your lives that you trust. It doesn't have to be, it could be one person that you really trust and that you can communicate that you might be having a bad day with. By being able to talk about your memory issues, you can then start to feel that they're not your problem only, and that it becomes a lot less stressful for somebody. I think especially if you've got somebody that is purely there to make you feel that you're not alone, that can take away from you having to try and cope too much on your own. So if you're going to the grocery store, for example, definitely take a list, take a pencil or a pen, cross it off so you don't have to keep in mind what you're doing. Because it might sound like something that maybe you've been able to do in the past, but it's amazing how quickly those aspects of working memory can be affected. In terms of semantic memory, the good news is that type of memory for knowledge of the world usually stays relatively intact. It's the areas of memory such as episodic memory, to a degree working memory, that start to be impacted by like either a change in the hippocampus or stress. Stress in particular really affects the memory system. So even if your listeners haven't necessarily got what we call an organic brain injury, something that structurally changed the brain, then stress in its very essence changes the neurochemistry within the brain, and that can make the memory system less effective. So again, take the weight off, do some self-care, just try to take maybe 10-15 minutes out of a day and just do some breath work, or take a cup of coffee, go and sit down and just have some time to yourself. Again, might seem simple, but it will make a big difference if you're allowing yourself just to calm down. So I know they're very basic, but it's the basic things, as we've just said, that you can do yourself. So why not try them? And if you don't find they're helpful, then maybe go and see somebody that could give you, maybe an assessment like what you do at your clinic, and really get some advice But I think in the first instance, I'll try some of those techniques and just see if any of them are making that little bit of difference, because it will raise your morale and it will raise your self-esteem and hopefully your well-being as well.
Yeah, fantastic. Dr. Cooper, this has been great so far. I've really enjoyed this episode. If any of our listeners wanted to find out more about you, find out more about what you're doing, I know you have a great podcast and other projects you're working on. Can you let them know how they would get in or find you or get in touch with you?
Yes, certainly. Thank you for the ability to do that. So I run something called Everyday Neuro.com, and it's for anybody and everybody that's interested in neuropsychology, neuroscience. My areas, as you know, because we talked about it, are memory and attention and decision making, and also just in how to use well-being to really improve some of those things in everyday life. And also I've got the podcast series, the Everyday Neuro podcast series, and there's about 17 free episodes on there that people can have a listen to, right from concussion through to stroke and memory, ethics in psychology, all those different types of things. But there is a lot actually about what we've talked about, and there's a dedicated episode to developmental amnesia in there as well. So if anybody would like some more information, if that's particularly interesting to them for maybe a personal reason, they can check it out there. So there's the website, everydayneuro.com, and the Everyday Neuro podcast series as well. Yeah.
Great.
Oh, and I do online courses if anybody wants to know about the more structural parts of the brain and linking that to function. And that's through Teachable, but go to the website and you'll see it's all there.
Okay. So that's also at everydayneuro.com?
Yes, it is, yeah.
Okay.
Yeah, online courses.
Well, thank you again for being on the show today. I thought this was fantastic, all-encompassing. We covered a lot of topics today.
Thank you.
A lot of new things for the show. I really appreciate it.
No, thank you for the invitation, and it was a pleasure talking with you and the listeners. Thank you.
Of course. And this has been your host from the Neuro Wellness Podcast. Be well.